I'm Jodi Reese-Niemants, and I am a family nurse practitioner. I have a weekly clinic at Mom's Place Homeless Shelter in Council Bluffs, where I provide primary healthcare services to the homeless of our community. Not only are they residents here, I have taken care of street homeless from shelters in Omaha, and those even in a tent community that's nearby. I've been here for about a year and 4 months. Our clinic started out as like 2 hours a week, and we've quickly moved to daily, and the need is even greater. I am busy all day long. The homeless are an underserved, vulnerable, totally misunderstood population. I think that it's very easy for the rest of society to ignore something you don't understand. There are people with an individual story just like you and I. They're homeless because of a squeeze on the economy, job loss. They have mental illness. They have drug addiction, alcohol addiction. They come from that environment, poverty. They grew up with those things. Some of my patients actually have PhDs. Some of them have lost their good jobs because of a health emergency. People are actually discharged to a homeless shelter from prison. That's their discharge plan. So there are many reasons that I have that a person is homeless, and those are just to name a couple. My skill set, I believe, is something that can help this population that is essentially voiceless. I provide primary healthcare services, so I can actually do immediate need kind of things, which I really consider only like a Band-Aid, because none of it's really getting to the crux of why they have this disparity to begin with. They need education, they need counseling, they need support. I like to focus on disease prevention, but I feel like it's often frustrating and a bit of an uphill battle, even just down to nutrition, which, as we know, is the root of a lot of chronic illnesses that are preventable: diabetes, hypertension, obesity, and these things compound the health of the homeless and all of it. One of the things I struggle with daily in my practice is that of addiction. Addiction comes for many reasons, but one of the things is mental health services. People are often medicating a trauma that they have experienced in their past, or they are medicating a behavior, or repeating or mimicking something that they even grew up with. Our system lets these people down. We don't have enough facilities to address mental health. We don't have any outpatient programs or providers to assist and support these people. If I wanted to get a patient in to a rehab program that was ready, the delay is months at all. And by the time I see a person that's committed to, let's say, staying clean from meth or alcohol, they become frustrated, and they continue to be in their environment that is a trigger for their addiction. And while they were previously motivated to quit or to get some help, they don't like to be that way. The delays in getting them treatment or intake or support in any way leaves them vulnerable, and often they fall back into their addiction. Another thing I really struggle with in my practice is the way that people have been previously managed. Often you'll see in our system, and this is a very big problem, we in medicine tend to throw pills at people. We often give someone a drug for a pain, but we don't give them any other modalities or non-pharmacologic interventions to help treat their problem, and we just continue to throw pills and stack medications on them. People with addictive personalities need to be screened when we're talking about prescribing that way. They need to be time limited, and there needs to be a plan for getting a person through that period of their pain or their anxiety or whatever is being managed, and have them continue to be supported and seen through that. People bop around, especially the homeless. They're vulnerable. They are transient. They go to different healthcare systems, different hospitals. They see different providers. And I'm often struggling with the fact that I'm seeing new patients every week, and some of them are asking me for these medications, benzodiazepams, opioids, and it's because that's how they've been treated before with it. Some people sell them, and as a medical provider, we've all been burned, likely. We should be very careful about lumping a population of people that we deem as drug seekers or those that are just abusing the system. We need to watch how we judge patients, and we need to look at them as individuals. We need to support them through follow-up. We need to not only provide pharmacologic interventions, but we need to provide, like I said, mental health and other modalities. We have all been burned as medical providers in patients that we label as drug seekers. But I would encourage every one of my colleagues to take a step back and think twice while you're prescribing, and also what else are you offering to help this person through their acute pain, acute anxiety, depression, whatever it is.